the histological sections are concerned, they a few of them have disappeared from the slide apparently, but the black defects that you can see on the cut sections of the teeth on micro CT scan translate into kind of a black appearance, appearing as a void in the tooth. But you can see on histological section that even in these black areas there's tissue debris in there. The histological sections also have shown these vascular channel structures and these lateral branches present in infundibuli, even though you're not able to see them on CT scan or micro CT. However, when looking for the blood vessels, we weren't able to find any endothelial lining cells at the apex of the tooth, no matter what the age the sample was from. Also, we looked into kind of some of the red tissue debris found within the teeth, wondering if that was a blood breakdown product or hemosiderin, but there was no uptake of Prussian blue stain, which means that it's more likely to be feed material than anything else. And you can even see at the top of the vascular channel on the left-hand side there that there's actually kind of a cellulose structure in the plant material found there, not blood by any means. So most maxillary cheek teeth have these defects in their infundibular cementum, even if the cementum appears absolutely normal on visual exam or on CT, as we could suspect. And that once again means that food can become impacted into these channels, into these lateral artery channels, as well as the central vascular channel. And this can contribute, of course, to the development of complete caries, whether or not the occlusal surface is normal, yet again. So this may suggest that all infundibuli with these grade 2 and grade 3 caries involving the enamel or dentines should be restored, potentially. And this should also be taken into consideration with the crown length and the infundibular length and the age of the horse. Because as we know, it's possible that once teeth reach a certain age, they have a shorter intact crown and they're no longer susceptible to fractures, potentially, if they've walled off that cementum well. So that gets us into a restoration technique as far as aiming to restrict the progression of caries, immediately improve the integrity of the teeth, and also overall to prevent fractures and apical infection of the teeth. The procedure is meant to remove food debris and loose carious material using dental drills and files, and that's how it's done by most people today. In the past, we were using high-pressure abrasion, which was shown to be ineffective. The filling of the infundibulums then completed with flowable dual-cure dental composite. So the feed debris is cleaned out manually, and with these dental drills, we use a low-speed dental drill at Edinburgh. Some people use a high-speed drill. The infundibulum is then sterilized with a sodium hypochlorite solution, a dilute bleach, and then some people also use a calcium EDTA gel as well to break up any remaining debris. And then, of course, the goal is to achieve this completely cleaned out infundibulum. Then phosphoric acid is used to etch it, and a bonding compound is used. Some places use a combined one-step etch and bond. And then the dual cure composite is used. It's important in the horse's tooth to have both the ability to light cure it if the infundibulum is quite deep, and also with gravity, and also to be able to self-cure in case the light has not completely cured anything within the tooth. Of course, with the goal to be then the complete restoration seen several months down the road after they've come into wear in this horse. So as far as the current study is concerned, we're still progressing with that, and we've CT'd 20 teeth after extraction, after we've cleaned them out, and then 10 teeth after we've filled them, with 17 of the 20 being successfully completely cleaned. This is a large improvement over only a 46% success rate in the previous study. However, we still only have 5 of 10 filled successfully with no defect in the peripheral bit of the restoration. So need to maybe contemplate the technique there. Its clinical application is still being determined, however. We've just started to do it at the Dick Vet this year, and we'll continue to do that. It's been performed by several other dental specialists for years, but there's little published data on this. However, it has been taught at the European Veterinary Dental Congress this past year, so definitely becoming more popular in that respect. We'll continue doing micro-CT on erupted cheek teeth, looking for this vasculature and trying to determine the exact cause of these cemental defects. And we'll also continue long-term follow-up studies on horses that have undergone this restoration procedure. And so the answer is it's sometimes significant. I think particularly in younger horses, if there's severe caries, of course, if there's significant cemental hypoplasia at the apex, noted on imaging, if the infundibular apex is patent, of course, as we've seen with that direct infection, and also when the horse has experienced previous infundibular caries-related cheek tooth fractures, we need to be particularly cognizant of their remaining teeth. Thank you all very much for your time.
If I can ask the speakers to join me just for 2 quick questions, if there are any in the room, or you're probably all ready to go off to happy hour. Are there any questions at all? You're all desperate to go for a drink. Rob?
When you're restoring those lesions, you're leaving quite a significant amount of cementum within the infundibulum, and human dental materials are designed to bond to dentine and enamel, not cementum. So do you think it's appropriate to leave that cementum? Do you think the bond strength is sufficient? Do you think the micro leakage is an issue?